In this segment, we're going to look at some orbital vascular anomalies. First, we're going to learn some definitions. So, a hemangioma grows, then involutes or stabilizes. These are lesions of early infancy where they grow and stabilize. Okay? They have a solid appearance with many endothelial cells, and as they involute, the vessels mature with fibrosis. They're mainly in infants. Pyogenic granulomas do occur in adults, but this type of hemangioma and pyogenic granuloma has another name called lobular capillary hemangioma. They grow, then involute. So remember, hemangioma, grow, involute, mainly children. The things that we used to call hemangiomas are now mostly called vascular malformations. So, for example, the port wine stain is a capillary malformation. We get lots of venous malformations in the orbit. Occasionally, we see lymphatic malformations, but more commonly, they're mixed with venous malformations. We can tell the difference on ultrasound between venous malformations and arteriovenous malformations because the latter, the ones with the arteries in them, are high flow. They're rare, and AV fistulas are also rare, high flow lesions that are congenital. All right, so here's the explanation with pictures. Hemangiomas are the most common orbital tumor of infancy and childhood, and they look like this with numerous endothelial cells proliferating and maturing into bigger vessels. Cavernous venous malformations are the most common orbital benign lesions of adulthood, and they look like this, all right? And they have large and small vessels which are surrounded by smooth muscle because these are venous malformations. So what are the vascular lesions you need to know? Hemangioma, lobular capillary hemangioma, i.e. pyogenic granuloma, and cavernous venous malformation, previously called, but no longer, a cavernous hemangioma. So let's have a look at this one. This is a lesion from the eyelid. This is kind of got an ulcerated surface here where the arrow is pointing, and there are central large vessels. Okay, and these ones here we call feeder vessels. And again, with the eye of faith, you can kind of imagine that this might have a vaguely lobulated architecture. This is another one where we've got the lobulated architecture shown better, right? And these are the little maturing vessels. Do you have a diagnosis yet? This is a lobular capillary hemangioma that used to be called pyogenic granuloma. So this is maturing quite nicely. We can still see some little capillary-sized vessels and then some larger ones, along with some fibrosis. Note, no smooth muscle, no smooth muscle. These are enlarged capillaries. A higher power view, we can see these are lined by endothelial cells and still no smooth muscle. These lesions have a rapid growth phase, so we will find mitoses in them. Not all mitoses mean malignancy, particularly if they are normal mitoses like this one is. Okay, so let's have a look at this. This is the gross surface. You can see it's quite spongy looking, isn't it? So if you can see it with your eyes, the vessels are generally more than a millimeter in size. It's also got these kind of yellow areas. Let's have a look. Oh, this is here. This, you see, it's very well circumscribed here in the orbit. It's also looking like it's got solid areas and less solid areas. All right, so this is a higher up one, and the word that we're using to describe the shape of the vessels is cavernous, and this is circumscribed. So we have a cavernous vascular proliferation that is circumscribed. This is a cavernous venous malformation. And if we look at it closely, we can see a very bare, thin band of smooth muscle around these vessels. And these are veins. Sometimes we get capillaries mixed in with them, which don't have the smooth muscle. All right, so these are the blood vessels at the base of the lesion. These are still veins. They are thick-walled veins. They don't have an internal elastic lamina. They are not arteries. Okay, and that brings us to the end of the discussion of our vascular lesions.